Achieving true clarity in hearing, moving from constantly asking what to understanding clearly, is a profound transformation many seek. This isn't just about the physical ear. It often involves the brain's ability to process sound effectively, manage background noise, and even overcome internal disturbances. People often try various approaches, from simple ear hygiene to complex medical interventions or even lifestyle adjustments, aiming to reclaim their auditory peace and improve communication. Before this transformation, many find themselves in a challenging situation. Millions worldwide experience persistent internal noises like ringing, buzzing, or whistling, a condition that severely impacts their daily lives. This isn't merely an annoyance, it's a structural problem, often linked to inflammation in the brain and damaged neural pathways that misinterpret signals. This constant auditory interference leads to significant difficulties in concentration, memory issues, often described as brain fog, disturbed sleep, and heightened levels of anxiety and stress. Imagine trying to follow a conversation or focus on a task when your own head is a cacophony of unwanted sounds. It makes simple interactions exhausting and can lead to social withdrawal and a diminished quality of life. The desired future is one of restored peace and quiet, where sounds are clear, conversations are effortless, and mental clarity returns. This transformation means improved sleep, a significant reduction in stress and anxiety, and enhanced cognitive functions like focus and memory. However, it's crucial to set realistic expectations. Achieving sustainable auditory clarity and mental peace typically requires consistent effort over time and often involves a multifaceted approach. It's not usually an overnight fix, but rather a journey towards repairing underlying issues and maintaining overall brain and auditory health. The timeline for noticeable improvement can vary greatly from person to person, often spanning weeks to several months of dedicated practice or treatment. There are several possible bridges to this desired transformation. One approach involves targeted natural supplementation, which focuses on addressing the root causes like brain inflammation and repairing neural pathways. This type of supplement often contains ingredients like Ginkgo biloba, St. John's wort, and Bacopa Monieri, known for their neuroprotective and anti-inflammatory properties. These ingredients work by calming the brain, enhancing blood flow to auditory centers, and nourishing damaged neural connections to restore healthy communication. This specific bridge is often most suitable for individuals who have explored conventional options without full success or those seeking a natural, non-pharmacological route to support their auditory and cognitive health, especially when the underlying issue is suspected to be related to inflammation or neural damage. However, it's essential to compare this with other available options. Free or low-cost bridges include lifestyle changes, such as stress reduction techniques like meditation, regular exercise, adopting an anti-inflammatory diet, and ensuring adequate sleep. Sound therapy, using white noise generators or apps, can also offer temporary relief by masking internal sounds. Moderately priced options might include specific cognitive behavioral therapies aimed at coping with the distress of persistent sounds, or over-the-counter ear protection to prevent further damage. Premium options involve professional medical consultations, specialized diagnostic tests, or more intensive therapeutic interventions, including hearing aids or other devices prescribed by audiologists. You should choose a different bridge if your symptoms are sudden, severe, or accompanied by other neurological signs like dizziness, weakness, or sudden hearing loss, as these require immediate medical evaluation by a doctor. If you are seeking immediate symptomatic relief from distress, prescription medications or professional counseling might be a more direct initial approach. Furthermore, if financial constraints are a major concern, focusing on free lifestyle changes and sound masking techniques should be prioritized. This natural supplement approach has limitations. It is a dietary supplement and not a medical drug, meaning it is not intended to diagnose, treat, cure, or prevent any disease. Results can vary significantly among individuals, and it may not be sufficient as a standalone solution for everyone, especially those with severe underlying medical conditions. Consistent use over an extended period is typically required to observe significant benefits, and it should always be used as part of a broader health strategy that includes a balanced diet, regular exercise, and stress management. The before was a frustration, a daunting situation. The after, there are several possible bridges to this transformation. If you've evaluated your options and believe this approach aligns with your situation, information is available in the description.